there is this tiered system about who gets it first, the priority list, if you like. And within that, there will be some big questions for the government, for the Department of Health, about those with extra vulnerabilities, perhaps cancer, other illnesses, who will be moved up the priority list, not necessarily according to their age. So it will be a difficult undertaking, but as you say, a positive note overall from the government today.
And in terms of this vaccine and in terms of people taking it, the government is very keen to reassure the population that it is safe. Obviously, the shot of the Prime Minister having a vaccination will be one that they will want to get out there, but equally, they won't want to bump him up the list, will they?
No, it's a bit of a difficult one when it comes to PR. I think Matt Hancock, the Health Secretary, offered to do it live on television earlier on today. But there is a question about the safety. Of course there is. People want to know that everything has been done correctly. And we had that reassurance today from the top experts in charge of making sure that this is ready to go. They say the reason why they've been able to approve it so quickly is not because any corners have been cut, and that's absolutely essential, but because they were preparing to do so well ahead of time. They were getting all the steps in place over the summer when they knew that a vaccine was a possibility, so they were able to be quick off the mark when it came to batch testing and ultimately to approving it. The World Health Organization has now actually asked for the data and for some help if they can recommend and approve the vaccine themselves, do anything they can to speed it up across the world. And crucially, we heard from Sir Keir Starmer in Prime Minister's questions today. The Labour leader asked the Prime Minister for a comprehensive communication strategy so that all MPs across the House of Commons could say exactly the same thing to the public over the coming weeks, because as you hit on there, really, one of the most important parts of this rollout will be public trust. It will be ensuring that people know they can take the vaccine safely and that they can rely on it. And those tests to make sure that the antibodies stay in people's system, to measure how long they are safe for, how long they're protected for, that will go on. The scientific side of this is not ended by any means. Those trials will continue over the next couple of months, perhaps even the next couple of years. So a huge amount of work has gone into making sure that all of this has been done safely. Matt Hancock will reiterate that today, but expect to see that communication strategy from central government and perhaps even the start of it this afternoon when the Prime Minister gets up at that press conference, because that will be key to make sure that people feel able to take the vaccine. And of course, that's crucial to end some of these tough restrictions.
And as well as reassuring those that maybe don't want to take it, the government also has to reassure the rest of us to be patient. We'll leave that thought, sadly. We'll get your response to it later, because Matt Hancock is just about to address the Commons.
Mr. Speaker, with permission, I'd like to make a statement on the coronavirus vaccine. Today marks a new chapter in our fight against this virus. Ever since the pandemic hit our shores almost a year ago, we have known that a vaccine would be critical to set us free. So all through this arduous year, and it has been an arduous year, while we've been working night and day to fight the virus and keep it under control, we've been striving to develop the vaccines that can give us hope and let us eventually release the curbs on our freedoms that have bound us for so long. Thanks to the incredible work of the Vaccines Task Force, the Business Secretary and Kate Bingham, we've already amassed a huge portfolio of different vaccine candidates. We've backed 7 vaccines and ordered 357 million doses on behalf of the whole UK, one of the biggest portfolios per capita in the world. We've said from the start that a vaccine must be safe and effective before we'd even consider deploying it. Any vaccine must go through a rigorous process of clinical trials involving thousands of people and extensive independent scrutiny from the MHRA, one of the world's most respected medical regulators. Today, I'm delighted to inform the House that the MHRA has issued the clinical authorization of the Pfizer-BioNTech vaccine. This is a monumental step forward. It's no longer if there's going to be a vaccine, it's when. In our battle against the virus, help is on its way. Today is a triumph for all those who believe in science, a triumph for ingenuity, a triumph for humanity, and I want to thank everyone who's played their part in this achievement. The team at Pfizer, the team of scientists at BioNTech, the volunteers who stepped up and took part in clinical trials, and to the MHRA themselves, who've made sure that this is a vaccine that we can all have faith in. Thanks to their efforts, I can confirm that the UK is the first country in the world to have a clinically approved coronavirus vaccine for supply. And now our task is to make use of the fruits of this scientific endeavour to save lives. Mr. Speaker, we've spent months preparing for this day so that as soon as we got the green light, we would be ready to go. We were the first country in the world to pre-order supplies of this successful vaccine, and we have 40 million doses pre-ordered for delivery over the coming months, enough for 20 million people because 2 jabs are required for each. Following authorisation, the next stage is to test each batch of the vaccine for safety, and I can confirm that batch testing has been completed this morning for the first deployment of 800,000 doses of the vaccine. These doses are for the whole United Kingdom. This morning I chaired a meeting of health ministers from the devolved administrations to ensure the rollout is coordinated nationwide. This will be one of the biggest civilian logistical efforts that we've faced as a nation. It will be difficult, there will be challenges and complications, but I know that the NHS is equal to the task. Rolling out the vaccine, free at the point of delivery, according to clinical need, not ability to pay, is in the finest tradition of our National Health Service. And I'm delighted to confirm that the NHS will be able to start vaccinating from early next week. The whole purpose of the vaccine is to protect people from COVID so we can get lives back to normal. So we will prioritise the groups who are at greatest risk. This morning, the Joint Committee on Vaccination and Immunisation has published its advice, setting out the order of priority according to that clinical need. And this includes the care home residents and their carers, the over 80s, the frontline health and social care workers, and we will deliver according to clinical prioritisation and operational necessity because of the need to hold the vaccine at -70. It makes this vaccine particularly challenging to deploy. And while we begin vaccination next week, the bulk of the vaccinations will be in the new year, but I would urge anyone called forward for vaccination by the NHS to respond quickly to protect themselves, their loved ones and their community. Mr. Speaker, over the next few months, we will see vaccines delivered in 3 different ways. First, we will begin vaccinations in hospital hubs. Second, we'll deploy through local community services, including GPs and, in due course, pharmacies too. And third, we'll stand up vaccination centres in conference centres and sports venues, for example, to vaccinate large numbers of people as more vaccines come on stream. This is an important step, but we are not there yet. And so I want to stress that we must all keep playing our part, keep following the new rules that the House approved overwhelmingly yesterday, and remember the basics like hands, face, space and get a test that we know from experience are so important in keeping the virus under control. Before I finish, Mr. Speaker, may I also update the House on another bit of good news. From today, I'm absolutely thrilled to say that we can safely allow visits in care homes for those who test negative for COVID-19. Coronavirus has denied so many people the simple pleasure of seeing a loved one, which is so precious to so many, especially in our care homes. This is only possible because of the success we've had in building one of the biggest testing capacities in Europe and working with local and national teams working together side by side, something we've often discussed right across this House. We've worked hard on testing, we've worked hard on the vaccine. Our strategy of suppressing the virus until a vaccine can make us safe, that strategy is working. And I'm delighted that we'll be able to see families and friends come together ahead of Christmas, thanks to this improvement. Mr. Speaker, this is a day to remember, frankly, in a year to forget. We can see the way out of this, but we're not there yet. So let's keep our resolve, keep doing our bit to keep people safe until science can make us free.
Shadow Secretary.
Thank you, Mr. Speaker, and as always, I thank the Secretary of State for advance sight of his statement. This is indeed fantastic news about the Pfizer vaccine, and I want to join with the Secretary of State in congratulating all who have been involved in making this happen. We have rightly clapped carers throughout this crisis, Mr. Speaker. I wonder if we should, as a nation, come together and applaud our scientists as well one evening. And it is also incumbent upon all of us across this House to reinforce the case that vaccination saves lives. And if it helps, I will stand alongside the Secretary of State, socially distanced of course, on any platform or in any TV studio to show that we are united cross-party in promoting vaccination. Yeah. Now, Mr Speaker, our constituents will have legitimate questions. And they shouldn't be ridiculed for asking legitimate questions. So will he launch a large-scale public information campaign to answer questions and encourage uptake? Will he consider sending a pamphlet, perhaps, to every household? Now, we know that dangerous myths circulate on social media, and we repeat our offer to work with ministers to curb online harms, and I hope we can work together and take something forward on that front. Hospital trust staff will start receiving this vaccine first. I understand it's a massive logistical exercise, given the temperatures and the need for 2 doses. But could he tell us how many NHS staff he expects to be vaccinated by January, of course, the time when we expect the NHS to be under most pressure? But also, where does this leave social care and care home residents and staff? There are concerns that this particular vaccine cannot be moved multiple times to care homes. So can the Secretary of State set out exactly how and when care home residents will receive a vaccine? And our constituents will want to know, when will primary care networks start rolling out vaccination? And when will the mass vaccination centres he's reported to the House start opening in our communities? Now, we have historic strengths as a country with vaccination, but in recent years we've actually lost our measles-free status because we know vaccination rates can be lower in poorer and vulnerable communities. And we know that COVID has had disproportionate impact often in these communities. So will he ensure there's a health inequality strategy as well in his vaccination campaign, so black and minority ethnic groups and the poorest and the vulnerable don't miss out on this vaccine? I think we all understand, Mr Speaker, that restrictions will have to remain in place for some time. But can he offer us a time frame or a target for when we should expect to achieve herd immunity and life gets back to normal? Will he consider publishing a route map of what restrictions could be released as vaccination rates increase? And in the meantime, if someone is vaccinated, will they still have to isolate if contacted by test and trace, or are they now released from that obligation? Just on mass testing very quickly, Mr Speaker, some directors of public health have told me that the lateral flow tests are not licensed for door-to-door testing in hotspots and therefore can only be administered at sites. If that's correct, can he resolve it? If it's not correct, can he issue urgent clarity to directors of public health? And in the government's document published on Monday, it suggests that local areas could use mass testing as a freedom pass. Could he outline to the House what that means in practice? Will local areas enforce rules? What happens if some people are able to follow, had the test and not had the test in a particular area that is supposed to be under Tier 3? And in the House yesterday, the Prime Minister suggested that people may want to take advantage of mass testing ahead of visiting their families this Christmas. Could he update the House on whether that is the plan and how will that be implemented? We, of course, welcome his news on care homes, but many care homes report that they'll need resources to support this testing exercise. Will those resources be in place? And very finally, Mr Speaker, if mass testing is to work in these communities, people will need support to isolate if they are found that they've got COVID when they are not feeling unwell. Will he now expand the eligibility criteria for the £500 grant? But this is a good news day. And we should all pay tribute to everybody who was involved. We should pay tribute to the scientists. And I say again, we will work together to make the case that vaccinations save lives.
Secretary of State.
Thank you very much, Mr Speaker. Mr Speaker, if I may, the honourable gentleman has worked supportively and constructively with the government throughout this pandemic. And I pay tribute to the approach that he's taken and that he took again today. I stand with him in saying vaccinations save lives. And if we can together encourage anybody to take a vaccine who may be hesitant by appearing together and being vaccinated together. Then, of course, I'd be happy to do that. I recommend, Mr. Speaker, that we have a professional vaccinating us, of course. I don't think he'd trust me to do that. He asked for a public information campaign, and there will, of course, be a public information campaign. And he asked about health inequalities, which is a very important consideration. Of course, the best thing to support tackling health inequalities is the fact we have a vaccine, but we absolutely need to try to reach all parts and all communities across the whole country. He asked how many will be vaccinated by January. And while today brings more certainty, Mr. Speaker, it doesn't end all uncertainties, because while we have 800,000 that have now passed the batch testing, the total number that will be manufactured over this time frame is not yet known, because it's all dependent on a manufacturing process which is complicated itself. After all, this isn't a chemical, it's a biological product. So I can't answer that question. That is as yet unknowable. He asked when the PCNs and the centres will open. The answer is very soon. We have 50 hospital hubs ready to go from next week. The PCNs are also being stood up, and the centres, which are the centres outside of hospitals, and these are all coming very soon. He then asks about when we'll get to lift restrictions. And of course, I understand not only why he, but almost everybody in the country wants to know the answer to this question, which is how many people do you have to vaccinate before you can start lifting the restrictions? And the answer to that is that while we know that the vaccine protects you as an individual with a 95% efficacy, we do not know the impact of the vaccine on reducing the transmission, because of the problem of asymptomatic transmission, which has been so bedeviled our response to this virus and made it so hard to tackle. Therefore, we don't know the answer to that question. But what we will do is follow the same 5 indicators that we were discussing at length yesterday, which are the indicators of the spread of the disease. We'll look at the cases, the hospitalizations, and of course the number of people who die with COVID. And we would hope very much, as we vaccinate more and more vulnerable people, that we will see those rates come down, and therefore we'll be able to lift the restrictions. So we will have to see how the vaccination programme impacts directly on the epidemic, and then, of course, move as swiftly as we safely can to lift the restrictions that we all want to see gone. He asked about the point on the community testing being licensed from door to door. I haven't heard that problem, and I will make sure that I get back not only to him but also to those who raised it with him, if he'll work with me on that. I'm a bit surprised. The lateral flow tests do need a professional to administer currently, although we hope that we can move further than that. But that can be in any setting, as far as I know. So I'm a bit surprised to hear that. But since it came from a public health professional, I'll dig into it further. Finally, he talked about the testing prospectus that we launched on Monday. We do hope to be able to use testing to do more things that we wouldn't be able to do without the testing. In a way, the visits to care homes are an example of that. That is something that we now can safely recommend that we couldn't recommend before. So too is test to release on quarantine for people coming into this country. And if there are further examples that can be safely done of this sort of enablement of normal life through the use of testing that can be approved by a Director of Public Health and by the Chief Medical Officer and his team, then we are very enthusiastic about working with local areas to deliver that on the ground. There's lots of ideas out there, and I would urge people to be creative about how we can do this in a way that enables some of the things that we love to get going again, but does so in a way that also keeps people safe. That's what that part of the testing prospectus was about. I'm very enthusiastic about it and look forward to working with directors of public health and with colleagues, because the Prime Minister also said this yesterday. He said, with this rollout of mass testing and the availability of these tests, we all, as leaders in our local communities, have got a role for promoting the role of mass testing. And I'm sure that there are communities right across the country represented in this House who can benefit from this rollout. There's many people looking around the chamber right now who have already approached me, Mr. Speaker, not just in Lancashire, and I look forward to working with colleagues right across this House to promote this public health message, amongst all the other important public health messages that we have to promote, not least that if the NHS phones you up or sends you a letter and says that there is a vaccination slot open to you, then just say yes.
Sir Bernard Jenkins.
Thank you, Mr. Speaker. And can I congratulate my right honourable friend on this moment and the government for the news about the Pfizer vaccine. But please, can we continue to have increased honesty about what we still don't know, that we don't know how long the immunity will last. We don't even know if you are vaccinated, whether you can still transmit the disease. And of course, we don't know if Tier 2 will actually succeed in bringing the R rate down. And until we can answer those questions, we still need maximum effort behind contact tracing and isolation of virus spreaders. Councils like Essex need daily access to all the positive cases recorded by NHS Test and Trace immediately and without delay in order to make their own operations effective. So why are they having to wait 48 to 72 hours before they get the data? And what is the government going to do to engage districts and their community volunteer hubs to help people to persuade people to support people who still must isolate, even if they have been vaccinated?
Thank you very much, Mr. Speaker. Well, dealing with this pandemic has been a case of dealing with uncertainty in large degree. And today we have more certainty because we know that this vaccine is safe and effective. But just as I was saying to the honourable member opposite, that we don't know the effect of the vaccine on transmission, so we, as my right honourable friend says, we don't know the effect of the vaccine in terms of its longevity, how long it will be effective for. He's quite right about another part of public health advice that we can all play a part in as local representatives, and that is the engagement with contact tracing. I will write to him on the point about the access to daily data in Essex. Of course, we have to wait until the test result comes in, which can sometimes lead to a delay, even though now the majority of tests that are done in person do come back within 24 hours. But I agree with him in principle, and let's make that reality in practice.
Let's head up to Scotland with SNP spokesperson Dr. Philippa Whitford. Dr. Whitford.
Thank you very much, Mr. Speaker. As chair of the all-party group on vaccination, I absolutely welcome the authorisation of the Pfizer vaccine and would echo the Shadow Secretary's call for a public health campaign to encourage uptake. It will naturally take some time before it's widely available, so we all still need to stick to the rules and ensure we can test, trace, isolate and support all those carrying the virus. Last week, the Secretary of State claimed the pilot project of mass testing in Liverpool was responsible for driving down cases, despite the city having been under lockdown for much of the time. Lateral flow tests miss up to 40% of cases, so the government's plan to use them to free people from isolation are causing concern among many public health and screening experts. So when will the formal assessment of the pilot be published? And how can he justify already putting out tenders for £40 billion of contracts to extend this approach without scientific evaluation? Would it not be better to invest some of this money in getting the traditional test, trace and isolate system working properly. As 6 months on, the Serco and Citel system has still not improved, and over 40% of contacts in England are still not being informed they should be isolating. He doesn't often talk about it, but he knows it's not testing, but isolation which actually stops the spread of the virus. So if people who are carrying the virus are not isolating, no amount of mass testing will stop its spread. When I raised the King's College report last week that less than 20% of cases and only 10% of contacts were isolating, the Secretary of State claimed the government has data showing much higher compliance. So can he tell us the figures for isolation rates for those with COVID and their contacts? People won't stay off work if it means they can't feed their family. So is he concerned at reports that many requests for the isolation payment are being refused? And how will he ensure that those carrying the virus are financially supported to isolate and reduce its spread?
Thanks very much. Well, the honourable lady says that I don't talk about contact tracing very much. I was literally answering a question on contact tracing in the previous intervention, Mr. Speaker. I talk of little else. She asks also about the questions. We are publishing further data tomorrow on contact tracing, precisely in response to the question that she asked. And she'll see that the continued improvement of our contact tracing across the country is advancing further. And we'll see that in the... I can't say any more than that because the figures aren't released until tomorrow. She asked about scientific evaluation. Absolutely, we're constantly scientifically evaluating the work that's going on, especially in Liverpool. That's one of the things that the scientists who work as part of my team and who work in NHS Test and Trace and work in Public Health England, that's one of the things they do. It's a matter of constant scientific evaluation. But what we won't do is wait ages after something has finished to then do an overly long evaluation. What we do is we have to evaluate as we're going along, and we have to do that because we're constantly trying to improve the response to this pandemic, and we're constantly trying to learn. And I would urge her to support the approach of constant learning and constant improvement. We're going to have to do that through the rollout of the vaccine too. She shakes her head, but that's how you have to deal with a pandemic in practice.
Chair of the Select Committee, Jeremy Hunt.
Mr. Speaker, this is a huge personal triumph for the Health Secretary, who has always backed the science. And in choosing and backing on behalf of the country the first vaccine to prove efficacious, he has scored a massive goal for the country. He deserves great credit for that. And it will also have global significance. I was in a meeting with the World Health Organization this morning who congratulated the UK on being the first country to approve a vaccine because it will help encourage other countries around the world to approve vaccines faster. I want to ask him, if I may, about something different, which is the plight of people with learning disabilities. He will know that Public Health England say that they are 2 to 4 times more likely to die from COVID. And the news that he's given this morning about people in care homes is tremendously welcome. But people with learning disabilities often feel that they are forgotten, particularly if they're in supported accommodation. And I wonder whether he could redouble his efforts to make sure that they too are able to be reunited with their families ahead of Christmas.
Well, my right honourable friend is gracious and kind in what he says. And I welcome the comments from the World Health Organization this morning, who've supported the UK approach and commended, rightly, the MHRA, our independent regulator, who have followed all of the same steps that any regulator, any high-quality regulator would and should and will. But what they've done is done them rapidly and sometimes in parallel instead of one after the other. And that's how we've got to the position of being the first country in the world to have a vaccine that is clinically authorised. It's because the MHRA has done a brilliant job working with Pfizer and BioNTech to make sure the same safety considerations are looked at, but they're looked at in a way that essentially made the process as fast as is feasibly and safely possible. And the WHO has backed that approach. And I think regulators around the world could take a look at the MHRA and we should all congratulate them. He rightly asks about making sure that we vaccinate those with learning disabilities and offer them vaccination at the right point in the prioritisation. This is an important consideration that I've discussed directly with the JCVI, who take into account the higher mortality of those with any given condition and have done that within the prioritisation that they set out this morning. Age is the single biggest determinant of mortality from coronavirus. That's why age is the predominant factor in the prioritisation, but it's not the only factor. And so that has been considered by the JCVI, and I think it's very important that we accept and follow the JCVI advice as much as is practicable in the delivery and deployment of this vaccine.
Munira Wilson.
Madam Deputy Speaker, and it is indeed a fantastic day. And could I add my thanks and congratulations to everybody who's been involved in getting us to this point, not just in the UK, but worldwide, because this is a great example of global scientific collaboration. Could I pick up the point about batch testing? The Secretary of State mentioned it on the radio this morning and in his statement. Could he clarify that if we signed up to a mutual recognition agreement with the EU, then we wouldn't need to batch test the vaccine again once it arrives in the UK, which could perhaps slow down the process, not least because in terms of having enough qualified persons who can do the batch release testing could be a real challenge. So is he working on a mutual recognition agreement?
Thank you very much. Well, we have that mutual recognition agreement in place now. And she's right to point to the global scientific work. Work between UK scientists and scientists based in the UK, of course German scientists at BioNTech, the American scientists and the Belgians who are producing and manufacturing this vaccine. It is an approach that has been about people coming together right around the world, and the UK has put more into the global search for a vaccine in cash terms than any other country. Despite our medium size as a nation, we have been the most generous, and I'm really proud of that.
Lee Anderson.
Thank you, Madam Deputy Speaker. It's great news about the vaccine, and on behalf of the residents of Ashfield and Eastwood, a big thanks to the Health Secretary, the scientists and the pharmaceutical companies. The small businesses in Ashfield and Eastwood have taken a massive financial hit during lockdown, despite doing their very best to be COVID secure. Meanwhile, supermarkets have recorded record profits. I've received lots of complaints this week from customers and staff at local supermarkets who say the stores are overcrowded and not COVID safe. And this is happening all over the country and is unfair to the small businesses who have been hit the hardest. So whilst the UK is being vaccinated, in the run-up to Christmas, traders in my constituency will do their very best to beat the virus. So could my right honourable friend please remind the supermarket executives that they have a duty to protect their staff, customers, our NHS and the whole of the UK in order to beat the virus and get our lives back.
Yes, Madam Deputy Speaker, I'm very happy to remind from this dispatch box the supermarkets of their responsibilities to follow COVID secure guidelines and ensure they're in place for their customers and their staff. And I also want to pay tribute to the honourable gentleman for standing up for the small businesses of Ashfield. It is tough in Ashfield at the moment, I get that. We have the restrictions in place only because they are absolutely necessary. And I know that he understands that, and he's a strong voice for the small businesses of Ashfield and indeed all of the residents of Ashfield in this chamber.
Jim Shannon.
Speaker, can I also, what a joy it was to see in the news at 7 o'clock this morning, the news being broken, and see the Secretary of State as well. I'd like to put on record my thanks to the Secretary of State and all his team for making this happen, and thank you. Is the Secretary of State aware that there are still those who are unable to access their flu vaccine? What steps have been taken to ensure that the flu vaccine rollout is completed before the Corona programme begins? And what discussions has the Secretary of State had with the Northern Ireland Assembly to provide vaccines and, more importantly, the rollout for our vulnerable and frontline key workers? Thank you.
Well, I'm grateful to the honourable gentleman for his kind words, and it has been a big team effort, I echo his thanks to the whole team. On the flu vaccine, we have a further tranche of flu vaccine ready to go. and that's just about to be rolled out. Making sure that we get flu vaccine available right across the UK is very important. It's an issue that Robin Swan, my opposite number in the Northern Ireland administration, and I have worked on extensively, and he is incredibly diligent in ensuring that we get the flu vaccine rolled out to Northern Ireland. There is an interaction between, of course, the massive flu vaccine rollout programme, which the NHS does every year, but this year is bigger than ever, and at the same time having to do a COVID vaccine rollout. We've taken that into account in the plans. And in fact, before the announcement at 6:30 this morning, I was talking to Robin Swan on the phone, which shows how hard-working he is.
Raymond Chisky.
The Health Secretary Matt Hancock addressing the House of Commons there on what he described as a day to remember in a year to forget. He confirmed that Britain has tested the first batch of 800,000 doses of the newly approved Pfizer-BioNTech vaccine. Batch testing completed this morning, ready for rollout early next week. We know from the Scottish First Minister Nicola Sturgeon that Scotland will be administering the first vaccine on Tuesday of next week. But it won't be easy. The Health Secretary saying that the rollout of the vaccine will be one of the biggest civilian logistical efforts that we've faced as a nation. It will be difficult. There will be challenges and complications, but I know that the NHS is equal to the task. We will deliver according to clinical prioritisation and operational necessity because of the need to hold the vaccine at -70. It makes this vaccine particularly challenging to deploy. Despite that, confirming that care home residents and their carers will be first in line for the vaccine. Well, earlier, the Prime Minister Boris Johnson urged everyone in the country to have a COVID-19 jab after the UK became the first in the world to approve a vaccine. Regulators gave the green light to the Pfizer-BioNTech jab this morning, and rollout will begin as early as next week.
I know that the whole House will want to join me in welcoming the fantastic news that the MHRA has formally authorised the Pfizer vaccine for COVID-19. The vaccine will begin to be made available across the UK from next week. I would like to pay tribute to and to thank all those who have made this possible. It is the protection of vaccines that will ultimately allow us to reclaim our lives and get our economy moving again. I strongly urge people to take up the vaccine, but it is no part of our culture or our ambition in this country to make vaccines mandatory. That's not how we do things.
Studies show the Pfizer-BioNTech vaccine is up to 95% effective and works across all age groups. The UK has ordered 40 million doses of it already, which is enough to vaccinate 20 million people because 2 doses are needed. Around 10 million doses are expected to be available to roll out in the coming weeks, with 800,000 doses available from next week for priority groups. The challenge is going to be how to distribute it and store it. This is the vaccine, of course, which needs to be kept at -70 to -80 degrees. However, it does remain stable for a limited time at between 2 and 8 degrees, allowing for it to be taken to distribution centres. Well, earlier, BioNTech's co-founder and chief medical officer gave a news conference in Germany with this update on the expected time frame.
We called our development program for a COVID-19 vaccine Project Lightspeed because you can't go faster than light, and this was what we aimed for. This journey started in January this year and was devoted to the development of a well-tolerated and effective COVID-19 vaccine following the highest scientific and ethical standards.
Live to Westminster now, and our political correspondent, Kate McCann. Good afternoon to you, Kate. It is a good day and some welcome news, not least for the government after a bruising day yesterday.
That's right, it is, and both Boris Johnson and the Health Secretary Matt Hancock have said so just moments ago in Prime Minister's Questions and in the Chamber for a question on the rollout of this vaccine. But both men also making clear that this is just the start of something that will be a very complex and very difficult process to roll out the vaccine to everyone who needs it in the country over the coming months. It also will not happen quickly, and so the Prime Minister in PMQs was very keen to point out that people shouldn't ignore the new tier system which comes into place today today. They shouldn't let up on following some of those restrictions that we've all found so difficult over the last year or so. He's very keen that people don't start to change their ways of living, to ignore what the government has been asking them to do for so long, because of course there is no evidence at the moment that this vaccine will stop transmission. It will protect you, but it might not stop you from transmitting the virus. Matt Hancock said that just before in the House of Commons, and that really is crucial, because what that tells you is the government doesn't have a number of people that need to be vaccinated, which makes the rest of the population safe. They are going to have to roll this vaccine out to every single person that they can get over the coming months, and that's going to take time. It's going to take careful planning, and it will not just be this vaccine. There are, of course, others that the UK government has got doses of. So it's going to be a careful process. And I think today, while you say that it is obviously optimistic and that people should feel a sense of relief, if you like, that there is a vaccine coming and that there will be changes, that we won't have to be like this forever, it's not going to happen quickly. Those in care homes will be prioritised, those who are caring for them too, and then by age range. And it's when we get to the sixth point on that distribution priority list, if you like, when we get to people who have cancers, long-term conditions, other things that may make them more vulnerable to the virus. So they may well have to wait quite a time too. So it's not going to be an easy couple of months, although it is positive news. And of course, Pfizer-BioNTech have said a lot this morning, and the regulator, about how this process has been sped up, the fact that it is very safe. There is now a few calls actually to Boris Johnson to issue a communication strategy so that all MPs and those in the public eye can be saying the same thing to the public over the coming weeks, because it will be absolutely essential that people feel safe, they're able to take the vaccine, and that they do take it when they are asked to do so. That will be the next crucial stage of trying to ensure that the UK can recover from this pandemic.
Kate, thank you. Let's speak to Sky's Roland Manthorpe now. And Roland, the UK first to approve a vaccine, but what happens next in terms of getting it to this rollout early next week?
Well, we were just on a call with Pfizer and they told us that the vaccine will be here by this weekend, and I think we can expect to see the first vaccinations next week. And it is just worth pausing to think what a remarkable achievement that is. I mean, even as recently as June or July, having a vaccine in December seemed almost impossibly optimistic. And yet here we are. And the target from Pfizer and BioNTech is to do 1.3 billion vaccines next year. And that's just one vaccine. We've got others on the way. I think that what we've seen here, or today, shows that the planning for this has been in place for quite a long time. We've had a number of briefings from the regulator, from the vaccine committee laying out who's going to get vaccinated, from the company, and then from the PM. And they were all saying pretty much what we expected them to say. We've got used to briefings which are chaotic and drama-filled and, which honestly sometimes arrive late and have very confusing slides. This was none of that. They were a little bit dull, wonderfully dull, you might say, because everyone was singing from the same hymn sheet. The company was saying, yes, we've got all the material,